past decade, some of you may have heard about individuals using fetuses to retrieve stem cell for tissue regrowth procedures. However, stem cell therapies have taken a more ethical turn in the last few years. For a while, this was quite a controversial topic in the US. Since it was illegal to use stem cells from a fetus, most people had a bad taste in their mouth when hearing the word stem cell. My hope is that I can inform all of you about some of the benefits of certain types of stem cell. It is important for individuals to be informed about this subject so when it comes up in conversation, they have at least a little bit of knowledge about it. Throughout the years, stem cell research has advanced in a way that has had positive results for people experiencing debilitating pain and diseases. My main points today will be what types of stem cell therapy are available in the United States, how stem cell works, and who is a viable candidate for the stem cell therapies that I'm talking about. Many of you may have known someone who's suffering from degenerative joints or have even had degenerative joints or diseases yourself. So this information really does benefit everybody. I currently work in an office that has close ties with the Stem Cell Institute of America, and I have seen the effect of stem cell firsthand. So first, there's 3 different types of stem cell that I'll be talking about. According to the International Society for Stem Cell Research, there's adult stem cell, embryonic stem cell, and amniotic stem cell. So adult stem cell is also known as somatic or tissue-specific stem cell. These stem cells can regenerate tissue for the specific organ or tissue in which they're derived from. They're typically taken out of the bone marrow and reintroduced into a specific area. For example, if a patient got stem cell taken out of a bone in his ankle, he could get it put back into his foot to help regrow tissue. The next type of stem cell is embryonic. So on the same page, the fact page of a closer look at stemcells.org, it says embryonic stem cells are obtained from the inner cell mass of the blastocyst, a mainly hollow ball of cells that in the human forms 3 to 5 days after an egg is fertilized by a sperm. These stem cells differ from the adult stem cell in that they can differentiate into many types of cells because of the rapid development of the blastocyst. This includes stem cell that can differentiate into any type of tissue in your body. The last type of stem cell is amniotic stem cell. According to Research America, amniotic stem cell has the ability to regenerate into any tissue in the body like embryonic, but is derived from the umbilical cord or placenta of a mother that has been monitored through her pregnancy and donates her placenta after a C-section. There is a thin layer containing the stem cell in between the outer and inner portion of the placenta. This is optimal because it means that neither the mother or the baby have even touched the stem cell, so it's very fresh. So now, how do stem cells work? There are 3 main concepts that encompass the process of a stem cell in a concise manner. First is cytokines. Dr. Jungming Zhang stated in his paper, cytokines are small secreted proteins released by cells that have a specific effect on the interactions and communications between cells. These proteins are a key factor in cell signaling or helping the body communicate with itself. Cytokines are extremely helpful in keeping the immune system functioning properly through their communication. The next is inflammation. Inflammation helps our body to identify a problem. This is considered a protective mechanism for our bodies. When an area becomes inflamed, it allows for the cells that fix or repair our tissue to rush to that area. So that area takes precedence over all other areas that are being fixed in our bodies. The next one is regrowth. So stem cell is full of growth factors. Growth factors are substances within our bodies that help to promote healing and growth within tissues. This is essential in stem cell because it literally regrows our own tissue. If a person were to, for example, tear their meniscus in their knee, an injection of stem cell could potentially help to regrow your body's own tissue. The cytokines help to identify which area is damaged and then relay that information to the rest of the cells. This allows for inflammation to take place. The area sometimes becomes swollen, red, and hot because there is an increase in the number of cytokines and growth factor to the area. When contained in a joint, this allows the stem cell to attach to the injured areas and to begin to regrow what has been damaged. It's important to also note that the stem cell grows tissue from your DNA. If you were born with a congenital defect, stem cell will not be able to change this. It will just be able to grow it back to what it was before. So the last concept is who would benefit from stem cell. So really anyone of any age will benefit from this. From my personal experience, it appears that the younger a person is, the faster they heal. And this is due to the fact that younger people have more stem cell in their bodies. According to Dr. Juan Encinas, between 1 month and 2 years of age, a mouse's normal lifespan, scientists observed a 100-fold decrease in the number of brain stem cells. So that just kind of gives you an example of how stem cells decrease with age. The second thing is encapsulated joints as opposed to just muscle tissue. When stem cells injected into an encapsulated joint, it stays in the right area for a longer period of time. Joints such as our knees, our shoulders, our hips, these are all considered encapsulated, meaning that a capsule surrounds the inside of the joint. This also means that there is not a good direct blood supply to the joint. However, this can be a good thing when considering having stem cell because injections into the joint capsule are more likely to stay within that joint. When stem cell is injected into muscles, which are innervated by a lot of blood vessels, the stem cell can be more easily pushed out of the area that it was supposed to stay in. The last concept is anyone who does not want to undergo surgery. This can be a tempting alternative to surgery, seeing as you do not have to go under medications. You don't have to have any incisions unless you're doing the adult stem cell where they take it out of your bone marrow, and your body is healing itself basically. There is a period of rest that is required with stem cell injections, just like a typical surgery. However, the extreme pain and recovery time do not accompany with the stem cell therapies. We have now discussed several ways in which stem cell therapy is an up-and-coming option for healing the body. There are 3 main types of stem cell therapy, including adult stem cell, embryonic stem cell, and amniotic stem cell. We have reviewed how the stem cell works through signaling healing proteins by our body's inflammation, and we have discussed which demographic would be a good candidate for these therapies. I would challenge you all to take the time to research all the new advancements in the healthcare field so that if and when the time comes, you know what your options are. I hope you have become more familiar with the concept of stem cell therapy and that you will keep this in your mind next time the topic comes up in your life.